Hi, I'm Regina with the Unrest campaign and we are here today to give you a brief overview of what's going on with Unrest and Time for Unrest. And we're going to start with Alyssa, who's working on the film and helping run the distribution of the film. And then we'll go into Laurie giving an overview of the Impact campaign and us jumping in to answer any and all questions folks have.
And then if it's easiest, I would say if you're not talking, you can put your mute on, so that way we're not hearing all sorts of different background, just so it's easiest.
And just one thing, Lori, whoever has the moderator code, that might be Erica. So Retha, if you can put your mute button on. Lori or Erica, you can mute it yourself. People yourself. So if you click on participants. Hi Retha, can you press mute? Hi Retha. Great. Okay. All right. Now we can continue.
Okay, great. Thanks, Ben. Thanks, Regina and Lori. So everyone should be on mute. Press audio off.
Sorry.
I'm Alyssa Namias. Go ahead, Ben.
Sorry, we're having an audio issue. So if you guys can hold on just 1 second, and Erica, if you can Slack me.
Yeah, you guys who are moderating, I think, need to press mute for all of the guests.
Sorry guys, just 1 second. We're gonna fix this audio issue. Hey Retha, can you hear me? There's somebody else now. Hey Gary, can you press mute? Okay, I'm gonna fix this in 2 seconds. Just a moment, you guys. I'm gonna leave.
Ben is our blue jeans ninja.
You can't hear me, can you?
Yes, we can.
You can hear me?
Yes, please mute yourself.
Oh, shoot, I tried. It's *6, isn't it?
I'm not sure. There's a button on mine that says audio on, and if I click that, audio off.
Okay, I'm going to try this one button here on my phone. I'll push it, you say something, and let's see, because I'm afraid it'll turn you off.
All right, so I'm on. Hi everyone again. Apologies for the delays. So I've got everybody who's a participant, if you can mute yourselves right now, and if you don't happen to mute yourselves, I will mute you for you. And all right, so Regina, why don't you kick it off again and let's start.
Hi all again. Sorry for the repeat for those of you who have been on and here in the whole time. I'm Regina. I'm part of the Unrest team and the Emmy Action team. And we are going to try to give you a quick overview of everything on the film release side of things and distribution side of the film and the impact campaign side of the film today, and then give you a bunch of time to ask us any questions you have. We want to thank you, before we go into any of that, for all of your patience for us getting the campaign together and the film ready to put out into the world. It's been a long process, and we are so excited to be at this point. I'm here with Lori Jones, who's our Global Director of Impact. Erica Ailes, who is our U.S. Impact Campaign Manager, Ben, who you all know and love, and luckily knows blue jeans, and Alyssa, who is a producer of the film and our director on the distribution side of things. So we are going to kick it off with Alyssa giving you a release update.
Hi, everyone. Thanks, Regina. Thanks, Ben. So as you all know, Unrest premiered at Sundance Film Festival in January of this year. It was an exciting and intense time for all of us. Very, very emotional. I'm like crying thinking about it. And just to see Jen there in front of that audience was incredible. And I know she's had the same kinds of experiences now at festivals around the world. If you're following her on Facebook, you'll see she was just in Australia at the Melbourne Film Festival. Maybe some of you on the call are even in Melbourne now, I don't know. But I saw the photographs and heard some of the stories, and it's just remarkable how powerful this film is, how visceral, and how motivated people are when they leave the theater to support you all and your families and loved ones and caretakers and physicians and everyone who's part of this movement. So we are harnessing that film festival energy, which is so important as far as getting press. The film won several awards. All of this nurtures the growth of the movement and the ways that we can then bring the film to more and more people. Once there is that demand in the cultural landscape, we're able to then to bring the film to more places than we would be had we not focused our energies for this moment on festivals. So that brings me to exciting news, which I know was announced in the Unrest newsletter this week, which is that our theatrical premiere is going to be in New York City on September 22nd, followed by many other cities. Right now, we know about West Coast in the U.S., we know about the United Kingdom, and there will be more. So we're working on all of that, and we welcome your ideas, and I'm happy to answer any questions about the theatrical part of the film. One thing I will say is that around theatrical, we will really need local support and work together with you all in your communities to get the word out, to fill the theaters, and we will work with you in terms of getting the press, not just any press, but the right kind of press that really talks about the issue in the ways that we need it to. One option in many theaters is group sales. So organizations and educational groups, schools, for example, can buy discounted tickets in groups. So if there are, for example, 10 or 25, the number varies by city, then you can get discounted tickets to see the movie in the theater. And our team is working with groups on that. So if you want to tell a local institution or organization about that opportunity, you can be in touch on our Time for Unrest Facebook page or by emailing our office. So we can give the information on that following the call as part of the wrap up. But we hope that you all will take advantage and share that opportunity with others. So really concurrent more or less with the theatrical run, we are going to make the film available digitally, and those details will be announced soon as well. There will be some pre-sales, for example, on iTunes, and then the opportunity to download the film digitally. And I know that that's so important to so many of you as well, to get that access at home on our computers. And let's see, we will also be doing a DVD, the details of which are still being confirmed, but we'll be excited to share that with you as soon as we have, a release date for a DVD. And then finally, well, not finally, because I think this film will have a life much longer, but as far as we're seeing with this initial release phase, we will have a broadcast in the United States on public broadcasting on PBS through the really incredible programming at Independent Lens, and that's going to happen in 2018. So I hope that gives, I know that was a lot of information quickly, but hopefully it gives a bit to chew on, and as questions arise, please make notes, and we're happy to answer what we can. That if Ben or Regina wanted me to say something else, feel free to.
No, I think that's great. We're going to go through kind of all of the updates, and then we're going to take questions on anything and everything. So that was perfect,
Okay.
Alyssa.
Super. Thanks, guys.
Thanks. We'll jump into an impact update.
Perfect. So we are so excited to begin the Time for Unrest Impact campaign. We are officially going to launch in September, though there are lots of things happening before then, particularly in the community screening world, where people can go ahead and get involved right away. And that's part of the reason why we started the Time for Unrest Facebook group, so that people can go ahead and start making all their plans together. So we'll make sure to send that link around to make sure that everyone on this call has that link and can join. And then we can all figure out next steps together. It's really cool to see just what a wonderful group of people are so inspired to do great work around the film and around all sorts of other advocacy efforts. So we are going to have a bigger impact call on August 19th at 11, where we're going in depth how to be a film captain and also really specific actions in the impact space. So today I just wanted to briefly go over some of our overarching goals, just so you have an idea of the campaign overall, and then talk to you about community screenings. First off, one of the reasons we wanted to have this call today is because Emmy Action is one of our partners for this campaign. And we're so excited to figure out ways that Time for Unrest can work with Emmy Action and all of the wonderful people that are involved in the Emmy Action community. We do have other partners that we're also working with, so it's very collaborative and cohesive, and we want to be as welcoming to anyone who wants to be a part of this space as possible. So just our 4 main overarching goals, and these are all big, and we'll need all of your help to do all of them. But the first one is to gain mass and strategic recognition of ME as a debilitating illness suffered by millions. So we really just want to get the word out far and wide. So we are going to try to do big stunts, small social pushes. We're going to have people advocating, telling their own stories on social. We want to get this word out as much as possible. And we'll have really specific details to come, but the more you can shout about this film, the better. We also want to mobilize a community of ME patients and allies to advocate on behalf of those with ME and other complex illnesses. And that, of course, is through the great work that you're already doing, and we want to support you and your efforts. So we've been working with Ben really closely on this, and we're really eager to have individuals more involved in a big way so that we can, support the great work you're already doing. And then the third one is we want to promote a culture of knowledgeable and empathetic care for ME within the medical community. So we do plan to go to medical schools across the country, medical association conferences, and really work with the medical community, doctors, nurses, everyone that encompasses the medical space to really advocate for a culture of empathetic care. And then lastly, we want to inspire new scientists to the field and inspire a concentration of work around ME from new scientists and funders. And we'll do that through our other partner organizations and through different educational groups as well. So we're very excited about that. So the biggest piece that we can do right now is host community screenings. And we are working with a wonderful organization called Film Sprout, where they're handling all the logistics of coordinating community screenings. And so today we have a fun announcement. So Emmy Action has bought 20 community screening licenses, which is great. So you can apply to do a free screening in your own community. And we'll send around a survey that you can fill out in order to get one of these free licenses. And then we look forward to helping you plan that. So after you fill out the survey, we'll figure out next steps with Film Sprout and with Emmy Action. Ben will let you know. We'll send this around right after the call to everyone. We'll also post it on our Time for Unrest page, and then I'm sure on the Emmy Action pages. And Ben can confirm that when he has his microphone unmuted, but I see him nodding, so I like that. So community screening can look a lot of different ways, and I'm happy to answer specific questions on that. But mainly we want people in your personal community to be able to see this film. And so we have community screenings being organized at schools, at churches, at local cinemas. They can look a wide variety of ways. But we hope that this film will be a catalyst for a conversation, and then moving people to concrete actions. And that's the whole point of a community screening model. And I know that many of you want to be able to access the film at home, and we are absolutely figuring out the next steps for screenings at home. We did have our first screening that was with a group of people who were all at their homes during MIF, where we used OV, which is partnering with, it's through ITVS. And you're able to view the film at the same time that other people are watching the film in a cinema, and then talking to each other about the experience. It is so exciting, and a lot of great conversations are able to be started. So we'll be posting more information about those screenings as we lock them down and make sure that you all are the first to hear about them. So that's it in a nutshell for me.
Awesome, great. And I know that Jen has joined us on the call. So Jen, I don't know if there's anything else you want to add before we open up for questions?
Yeah, well, I guess I wonder if Lucy might give a quick overview just of the UK, what's going on in the UK, and as well, potentially, before we open up for questions. I'm sure that there are some UK people on here. And just to mention also, we're working with Together Films in the UK on a wide variety of things, including community screenings and trying to get the film into as many cinemas as possible in the UK and Ireland.
Went over is for everything Laurie just went over is also applicable to the UK and anywhere else in the world. It's globally accessible, and so just to be clear, that wasn't US specific. That was for everywhere we're trying to get.
Absolutely, but Jen does raise a good point that I forgot to mention Together Films, which this has the same function as Film Sprout, but they're just in the UK. But everything is absolutely global.
Lucy, anything you want to add?
Hi everyone, it's great to see you all on here. I'm just counting there's 38 participants, so that's amazing. Yeah, I mean, I'm working very closely with the US team, and I'm recognizing some names here, which is brilliant. So yeah, we're doing a very similar campaign in the UK. I'm just aligning some of our impact goals to be a bit more UK specific. So I will have those signed off next week. And we're organising various screenings. We've been partnering with quite a few of the Emmy UK charities, and so we're looking at various screenings from going to Parliament to specific influencer screenings, special events. Everything's TBC at the moment, so I'd rather update when we've got a little bit more information. And we have been talking about possibly doing a UK specific call in the next few weeks as well. So yeah, it's brilliant to see so much interest in the impact campaign, the global impact campaign. So yeah, great to be part of it and see everyone.
Thanks, Lucy. Great, so we are now going to open it up to your questions. I know you guys have been submitting some to Ben already, but feel free to just jump on in.
So I can answer a question from Eddie about subtitles and interesting. My experience with subtitles is that they're not so very good. So we are trying to figure out exactly and like kind of lock down, hopefully by the end of this week, which languages we're going to be translating Unrest into. And so I will be able to say more, I think, next week about both those languages and the dates. It's logistically more complex than one might imagine to be able to kind of version the film for those languages. And so we're just trying to figure out the best way to do that at the highest quality possible. But we do anticipate that we know, and just to confirm, because there was some confusion about this, we know that the film will be subtitled in French, Spanish, and German. at a minimum, and we're looking at what other languages we can both afford to add, as well as what languages are, kind of have the most demand from the community. So we've heard a lot from folks about Dutch being a really important language, and if there are other languages, and especially if you guys are like, I really want to do, a bunch of screenings in my country in this language, that's really helpful for us to know, especially within the next few weeks. So please out. And even if we don't kind of get everything wrapped in this round, I think that there are, there's always a possibility of continuing to add more languages in the future at various phases of this kind of rollout in the life of the film. But our first focus is really figuring out what languages we want to be translated into for these community screenings. And so thanks for your feedback on that. And I will, I guess, turn it over to other questions.
I've got a few. Just when is our window for these community screenings, like as far as dates? And how much is like the cost of a license, particularly like I was hoping to maybe get my regional health authority office on board. Like what could I tell them as far as cost?
So if you apply to do one of the In the Action community screenings, then that would be free to you. If not, then it is about $250 for in the U.S. and then in the UK about £200.
I forgot to say Canada. Sorry.
Oh yeah, and yes. So that it is $250 US.
And just to sort of clarify, the kind of Emmy Action the Emmy Action licenses will be sort of kind of co-hosted with Emmy Action, and so it might not always be the best option if you're looking to do something with a health authority or like a government body or on a university campus. So it's sort of and we'll offer more details about what that means. But it's sort of, I think, in some ways, you'll have to think about like, what is, given the audience I want to reach and given kind of where I want to host the film, what is the best strategy? And oftentimes institutions like universities, for example, for them, they do events like this all the time. And so for them, the fee is nominal, but we also know for individuals who want to do kind of more community-based work, it could be a barrier. And so part of it was trying to figure out, because a lot of kind of Emmy organizations are getting on board and as an organization kind of hosting events. And so part of the idea with the Emmy Action license is to sort of make it accessible to individual organizers. So we'll kind of share some more information, and you can kind of then figure out what is the best strategy. And Emmy Action obviously has a kind of more political and activist bent, and that may not be the right option depending on who you want to reach and where you want to host the event. The one other thing I wanted to clarify on the language, which I forgot, which gets into sort of what your question about when. Community screenings are open now, so you can host them anytime starting now until the end of time. So it's really about when you think is the best time kind of for you in terms of your planning horizon and also what else is happening in your community. There are some small exceptions. So there are certain cities where we can't do screenings until we've done our theatrical release. So we won't be doing community screenings in London until after our theatrical release in London. And the same is true for cities in the US where we're doing these theatrical events. But the good news is that if you're in one of these theatrical cities, you can kind of, in some ways, perhaps get together and put energy into these screenings that are already happening. And so we can do things like take over a screening and, invite, partner with local organizations like buy out a screening or to, use these screenings as outreach events. So if you're interested in doing that in one of the cities where we know we're going to be theatrically, it's a great way to kind of be able to use the film without having to go through that planning of putting the event together. So that's another option. And the last thing I would just say on the language piece is that we do think that for these languages that we'll announce next week, we'll be ready to make the kind of Blu-ray that has those subtitles on it available sometime between mid-September and early October. So that's the time frame we're looking at. But we'll have much more specifics in the next week or so.
Okay. I'm sorry. Just a important question that jumped in my mind. I forgot to ask there. More with the movie itself. Does it talk at all about like how deep does it go in, like as far as the disease itself or treatment options, like as far as using it as like a continuing medical education kind of tool versus like political?
So the film is hard to explain, and if you it depends, I think, kind of what other documentaries you've seen. But the film is what I would kind of call it narrative, and by that I mean it really goes into our stories and the stories of our lives and what happens to you when you get this disease. And so that means like the physical consequences of it, like what does it actually look like and feel like to live with this from the inside? What is it like to not have access to care and research and answers? And what is the impact of the disease on families? And what is this movement that we're trying to build and why? And so I think that's the train it covers. It does not go into any kind of educational specifics. It's really just a kind of, and I actually think that's a really good thing in part because it allows you to have the most flexibility possible in terms of how you want to use the film. So what part of it is on figuring out what are the other materials and also what are the kind of conversations you want to have after. So if you want to have a conversation about caregiving or a conversation about clinical research or a conversation about disability rights or a conversation about the history and politics of the disease, the film kind of allows you to do that by digging deeper into what we kind of allude to. And the impact team, I think, can talk more about continuing medical education because that's something that I think we are exploring in a kind of more formal way, at least in the US and UK.
That's right, we definitely are. I don't think we're quite ready to announce which pieces of CME that are official, but we definitely are making progress in that space, which is really exciting. And all the feedback we have gotten really reflects exactly what Jen said about how this film is just a catalyst for all sorts of different kinds of conversations, including in the medical space. So we'll definitely give you guys updates. I think we'll be able to update you on the call on the 19th.
The one thing I would just say is I think this question, Lori, may have come from the same woman who's in Canada. And so as a team right now, I believe we are only going to be pursuing CME. I think in the UK it might be called CMD. And I don't know what it's called in Australia, but we probably are as a team pursuing those options in the US, UK, and Australia. So if you're in another country and you are interested in pursuing that option, we can definitely provide some general information, but your best bet is to sort of partner with a local ME organization to pursue that, I think, right? That's probably the best advice I can offer. But if you're not hooked up with an organization, we might also be able to give you some suggestions regarding the partners that we're working with.
Yes, absolutely. And I think once we have some patterns of success in the US and the UK, we'll be able to use them to hand off as learning experiences for different parts of the world. And considering that the UK and the US have very different healthcare systems, it will be good, two different polarized examples. So I think that will be helpful, and we'll happily hand that off.
Great. I want to just jump in here for a second, Jen and Lori. So just so you guys know, we have kind of a queue of different questions people have asked via chat, and I put them in that document that we could run through. We also have several people, in order to reduce the feedback, I've muted several people myself, and some of them are on phone lines, so they couldn't actually chat or say anything. So at some point we want to open the phone lines up for everybody to ask questions. So just however you guys want to handle that, we should do both of those things at some point.
Looks like somebody wanted me to repeat
a question.
group sales. Oh, go ahead. Go ahead, Jen.
Oh, sorry. Yeah, Alyssa, why don't you repeat that, and then I'll jump back in with my comment.
Okay, great. So I'll just repeat what group sales are in terms of theatrical and how you can go about accessing that. So group sales is when your local theater allows for a group rate at a certain number of tickets. So often 10 is the lowest, and each theater is different. Sometimes you have to have a minimum of 25 tickets. And that we can give that information to you. So if you're interested or you know a group who might be interested, the process is that they would email our team. And Erica, which email are we using for that? Maybe you can put it in the chat. I'm not exactly sure which email we're using for incoming inquiries, but we'll get that in the chat and also on the Facebook group. And so interested group leaders would email that and say, hey, we'd like to come on September 24th in New York City at 12 noon. And then if it's a big enough group, we would put you in touch with the theater and you could buy your tickets at a discounted rate. It's not, I mean, the discounts are not, it's not the 50% off, but it's a significant discount. And so we hope that people will take advantage of that. And then also you can kind of make an event of it, right? It's your group, it's your friends and family, whoever it is, you're all going to the theater together, you're all having that experience, and you got discounted tickets. There are some restrictions. They don't usually let you do this on a Friday or Saturday night when public ticket sales are higher. They often will not let you do it when Jen is going to be attending for a Q&A, just because those are more of a public draw event. You can still get tickets, you just can't necessarily buy it at the group rate. So I hope that helps. We hope that many groups take advantage of this. It doesn't have to be, it can be an institution, it can be a school, it can be an activist group. It can also just be an individual who creates a group for this purpose. So if your local theater allows group rates at 10 people and you want to get 9 of your friends so you all get discounted tickets, that works too. And if you have more questions, please let us know, but that's pretty much it.
Thanks, Alyssa. There's a question, a couple of questions about materials. So Susan Smith and asked questions about, actually, so Rivka was asking questions about, will there be a cover letter to give to hospitals along with the PR packet? And Kyla was asking, will there be any template letters for invites to influencers? I'm going to let the impact team talk a little bit about the kinds of materials that we know are coming. But the one thing I would say is that it's actually really helpful for us to also understand in terms of templates and language, like what would be helpful for you guys. So I do think that we can definitely, post in the Facebook group things like a sample email, like a sample pitch email that can be modified if you're reaching out to medical school versus like a cinema. And we can definitely also think about, we have our press kit, which has just been finalized, and which will probably be publicly available on our website soon. But Rivka, I think your initial reaction was like, oh, this is not in the right order. It's not exactly what I need. And that's really a tool for journalists. And so it's sort of not necessarily the best thing for kind of, to send to a cinema or to like a research university when you're pitching. So we're also going to try to put together like a much shorter one pager that kind of orders the information in a way that is more useful for that purpose of kind of pitching in terms of like event hosting. So I think in some ways, this will be a process in terms of getting some of these materials online and available to you. But certainly the more that we can know about what you need, the better. And at the same time, I think within the group, folks who are a little bit farther ahead in terms of the planning of some of these events have already started to discover really great tools and templates. And so we're also hoping the Facebook group can become a place for knowledge sharing and best practices. So at the same time, if someone has already come up with a really great, some really great, emails or things that they've used that they found helpful, I think sharing that in our kind of the files section, which is going to be our kind of our resources section, is also going to be a really great thing so that we can kind of not reinvent the wheel and learn from each other and build on strength. So that's my contribution. And I don't know if Lori, you want to go in and talk a little bit more about materials.
Well, I think that you answered that question perfectly, and I definitely echo Jen in that if there is something that you think would be really useful, please let us know. And the community's already done a great job of starting to answer each other's questions, which is really lovely. In terms of materials that we already have, we have a developed discussion guide, we have an invite template, we have a one-pager. We will make a one-pager of the press packet to get to everyone, and we'll begin pinning the public materials in the Facebook post, or we'll post them in the group so that you can have access. And then we will, as we create more and more materials, we'll be sure to update you all with what we have. Is there anything big I'm leaving out, Erica, in terms of materials?
We'll also be developing a social media one-pager that you can distribute to your community to just inspire them to post on social.
Awesome. Thank you.
Mm-hmm. Well, and I also think, just as the campaign kind of goes on, and this is all going to, I'm just looking at my team here, it's all going to depend on like our own capacity. But some of the things in terms of timing, but we are planning on doing things like releasing short content that kind of dig into some of the themes, but in like of the film, but in a kind of short, shareable way. And that can always be a great way of like developing interest and promoting the event. In addition to the trailer that's already public, we're also planning on doing, probably things that are more like social media. I call them tiled. I'm not sure what the best kind of, word for them is, but kind of graphics and things that are also shareable. So all those are things that we're planning on doing that I think can also be tools for you guys to use, whether it's for spreading the word about the screenings, or helping to engage on social around some of the calls to action around the campaign. So there's a lot coming, and we're going to endeavor to just keep you guys in the loop as the things become ready and launch.
Some of the questions about the specific people, like have we spoken to a medical New York Presbyterian hospital? A lot of the outreach being done through Film Sprout and Together Films. If you have people that you're interested, you can always email us. We're happy to hear. You can post it in the Time for Unrest group. So if you have specific people that you think would be great, or you can go ahead and make those introductions, or do outreach yourself. And the more of that, the better, because just like Jen said, we're doing so many pieces that the more you guys are willing and able to do outreach, especially people that you have great ideas for, that would be amazing. And we'll try to make sure you have all the materials you need in order to do that. So as we're getting these materials ready, we'll make sure you're up to date on them so that you can do the outreach that you would like to do. But in the meantime, you can always let us know if you have ideas, and we'll see if we can move forward on any of them.
Thanks, Lori. And the one other thing to mention is our Film Captain program. So I think we're going to go into more detail on that August 19th call about exactly what that means and the components of it. But the spirit of it is sort of, if you, and it's been really great as we've done festivals, occasionally like we'll come to a town and then someone will reach out to us and say, oh my gosh, I have all of these ideas, and we'll actually, like I talked to like this hospital and this medical school and like this community leader and this health commissioner. And so we really wanted to sort of create structure and tools to kind of empower that, and also to let people support other events. So if you don't have the capacity or inclination to host a screening, there'll be lots of opportunities to help spread the word and raise awareness about the theatrical screenings that we already know are happening. And then we also want the Film Council program to support the community screening. So if there's a community screening happening in your area, we really want to start to be able to empower people to then support those organizers and those hosts by helping to get the word out, get as many people to those screenings as possible. So we'll get into specifics kind of going forward, but that's just another way to engage and support this effort. And I think the other thing I would say is that one of the things that I've been finding, and I've now probably been in person at over at least a dozen screenings, if not more, in about 5 countries. There's definitely no one on here from Australia because it's like 3 in the morning or 5 in the morning or something. So, and I'm feeling it. But we were just in Melbourne, and I think the thing, as much as many of us are homebound and it's really hard to get out, there are a lot of other people who are less vocal, I think, sometimes in our community, who are mildly or moderately affected. As well as friends and family. And there's something really specific and powerful about people gathering together in terms of the conversations that happen afterwards and the relationships that are forged for this kind of community building. So our second goal is about kind of engaging in, the sort of, I'm forgetting what the language is, Laurie, but kind of mobilizing the community. And I think what I would sort of say is that it's actually, a big part of that is actually about community building. So my hope is that if you're an organizer in a specific city, that if you do one of these screenings, you come out on the other side with a much bigger pool of people for your work. So that means that friends and family are more engaged, people in the community have been engaged, and you have a broader base of those patients and healthy allies to do organizing work going forward, to fundraise from, et cetera, et cetera. So it's really about taking this core of amazing organization that we've started and growing and expanding it and really spilling out into that broader community and public. And so I think that's something that you can't do from just watching the film at home. And so that's really why we feel so passionate about creating these gathering opportunities wherever possible.
Can I ask?
And a correction,
I'm on
Jen.
the phone. I have a question.
Yeah.
Yes, it is.
Yeah.
But I think, well, we have to go on. They claim that I think they told us that their new technology is running on the Ray-Ban site. It's not running on the glasses.com site. And I haven't actually gone back to revisit the Ray-Ban site. Presumably, that comparison demo that we have that does include Ray-Ban is of their current technology.
I'm so sorry. I think we're missing your
question.
question.
That might be a question to ask of Image Metrics.
Hey, Garrett.
Whoever put that demo together, the longer demo, the first demo that was like 5 minutes.
This is Adrian.
Oh,
Hey,
sorry.
Adrian.
I think we're hearing in the background another conversation.
Go ahead.
Sorry about that.
What was the question? Who had it? Somebody have a question?
That may have been a question. That may have been background sound. Ben, you were going to say something.
Oh, I was just going to say, Jen, we actually do have somebody from Australia who's on the call right now, Kayla. So don't count Australia out. They're here.
What?
Yeah.
I'm impressed.
That is amazing. I see Terry had a question of how big of a venue does it need to be? And it really varies. Typically, we're looking at 25 or more seats is what we encourage you to have. But of course, some community screenings are 200 people. But it really does vary, and I think that you know your community better than we know it. So there may be people that you're ready to mobilize to do some really big actions, and it turns out to be a smaller group. But typically speaking, we're looking between 25 and up.
My question was, is there any opportunity or place where people, those of us who have MECFS, who aren't totally housebound, could be useful to like tell our stories in the context of like theatrical releases?
Yes, absolutely. So we're going to have a couple of different options for that. And we were going to go more in depth on the 19th call, but we are going to put a call out for stories in general for the Time for Unrest campaign. And that will be in conjunction with some of our events that are happening in theatrical cities, particularly around the New York launch. But there will be lots of opportunities, and I'm so happy that you asked that question. And so we'll be sending out more info actually within the next week or so. So we'll give you lots of specifics, but I'm thrilled that you asked that question.
I had a question about just in general, if you guys happen to, so I was wondering about like, how do I figure out who to contact at, for instance, the University Medical School? I saw there was some other people. Rivka was wondering who does she contact at a hospital, to set up a screening. If you guys happen to have any general ideas about, what's the title of the person that generally you would contact at a university or a hospital, if you could share that information. Not at a specific university or a specific hospital, but like, what's the title of the person you should look for to get in touch with about doing something like this?
So
Hi,
I think
Terry.
oh, sorry, go ahead. You should go ahead, Terry.
Can I jump in on that? So I was just going to share from my experience. So I work at Mount Sinai that has a medical school. So you'll want to look for like the dean of students or something like that when you go to the website. I wouldn't go to the dean of the medical school because I don't think you'll ever get that person to ever actually return your email. But you may want to look like for a vice dean of like student education or, something like that kind of title. So like when I just went to the medical school page for Mount Sinai just a few minutes ago, there was a tab for leadership, and it kind of gave me a nice directory of kind of what these different leadership staff covers at that medical school, and then you can kind of figure out by their title.
Okay, so the dean of students or the vice dean or something of the medical school.
And what I would also say is that
Sorry, just a second.
I would also say that like one of the things I'm forgetting now, but when we were going to South by, there was like a program at UT Austin that was like specifically around community engagement. So I think sometimes it totally depends on the institution, but sometimes there's I also think sometimes at hospitals this can also exist, but sometimes there are people who like in medical organizations whose job it is to do like patient engagement. So that's someone whose job it is to think about like how to engage with patients. I think that's always something that's good to look for. And on the school side, I agree with dean of students. There's also, I think, I would also look at if there is a kind of community engagement program or anything. It's kind of like a community-based medical kind of program, as well as looking at kind of labs and individuals who could be a champion for this, who from their kind of profiles make it really clear that this is sort of their work already. And that can also be, I think, a really great opening point. There's also sort of sometimes there's like gender and sociology like programs at medical schools. It's rare, but like it happens. And so you really just kind of want to sort of look for that person where you're like, oh, this is already their job. This is already their passion, and kind of go from there.
Okay.
Susan, there's also like for Mount Sinai, we have an Office of Diversity and Inclusion. And when I look at kind of all the different kind of areas that they cover, I mean, they cover disability, but they also cover LGBT. And so like they have all of these kind of buckets that they cover under that kind of bigger Office of Diversity and Inclusion. So I mean, that might be a good entryway because they often do screenings or special events around, a priority population or illness or something like that.
Okay. Thank you. Good ideas.
I'm gonna jump in with one question, you guys. Kayla asks, is anybody inviting media journalists to screenings, or is that not recommended for community screenings? What things is the Unrest team doing regarding media and journalism? What things should people be doing themselves? Do you have any recommendations about what the press strategy looks like and what people should be doing?
That is an awesome question. And I will say on past film tours that I've done, local press can come out for community screenings. So I highly recommend that you reach out if you're doing your own community screening. We will have a template press release for you that you'll be able to just fill in your personal details and then send it off to your local stations. But it's kind of amazing how often they'll cover community screenings, and it's really cool because then it just amplifies all the work that you've done to put it together. So it's a great question, and we'll definitely get you all the templates you need to do that.
Sorry, go ahead, Alyssa.
I was just going to add on press, everything Lori said, perfect. And I think with local press, that's a really great strategy. If you are in a place like New York or London or LA, and you have contacts or a friend who works in the press in national media, or even at the local level at sort of a major local newspaper, and they have serious interest in covering this at a high level, doing a feature on the film or really a more in-depth coverage, we would also love to be in touch with that person if appropriate. So we welcome being put in touch with those sorts of contacts, not necessarily the local roundup of what's happening this week in town, that you can just handle. But if it's a bigger, if there's more potential there, and we can really, because we do have some publicists on our team who can support, shaping stories in a really powerful way. So for the national level.
And just to kind of follow up on that, at present we have our publicists. We have publicists who are kind of focused on press in New York, Los Angeles, San Francisco, U.S. national press, and then also UK national press and London press. I don't know how much regional or local UK press that encompasses, but typically our team is focused on the really ambitious, big fish, really hard to get type of coverage. And we had a conversation where we were kind of trying to think, well, what about everything else? And the truth is that we don't really have the capacity. So that's, I think, where you kind of coming in and doing local outreach is so important. Moreover, local media care a lot more about people who live in that area. And so I think if anything, using the community screenings to highlight the researchers and clinicians in your area and the patients and the patient activists, whether that's you or other people in the community that you've identified to kind of do media, I actually think that's a much stronger pitch for local press. And I would also say that even though yes, completely, the national media matter a lot. What we have found, what people who have done, the sort of congressional and kind of state outreach know, is that actually politicians care a lot more about what's happening in their local media than the national media, because their job is to cater to you as constituents. So it's actually crucially important that we get local press as well. So for folks who are able to do that outreach, we were so excited, and we'll try to support it with kind of materials and templates in any way we can. And as Melissa said, if there's, even in a place like Chicago, we're not going to be able to do that much proactive outreach, but in really big cities, if something emerges and there's a way for our publicists to support it, we definitely want to know about it and have that conversation.
One other question I'm seeing some people ask that I think would be good, Jen, or someone to address, is the question of, people are asking, about the question of seeing how to, as they're going to different people, trying to get them interested in doing a screening, whether it's an entity like a hospital, a school, government entity, or whatever. Like, can they show the film to them first? Like, how do they? What things will be available and what won't, and how do you think about getting people, convincing people, and pitching them to be interested in showing this film? If there's someone that, a gatekeeper that needs to be convinced, are there best practices that you guys would recommend? And how can Unrest help?
Jen, do you want to take that one? Or do you want me to take it?
No, I'll leave that to you.
Yeah, so I think that the main thing we would like people to do is share the one pager and the trailer. The trailer is super compelling and it really explains the story of Unrest in a great way. So I think always let us know if you're getting an enormous amount of pushback, and we can see how we can help you. But we've been able to get a lot of people to show the film just based on the trailer and the information provided. So I more or less, you should be able to do that. You can always let us know if there's a really persnickety gatekeeper in your way, and we can figure out what to do next.
Thanks.
Are those the main questions, Ben? I don't see any more on the sheet that we haven't discussed. Are you getting any extra?
We're almost at the hour, and we can definitely answer more questions and go into more depth on the August 19th call as well. Perhaps before we wrap, Ben, to your suggestion, we might just see if there's anybody muted on the phone lines who had a burning question that they couldn't put in the chat box.
I just put up a question in the chat box. I'm not sure you can see it. Yeah, we have set up, I'm from the Netherlands. We have set up a great program in Amsterdam in the main hospital. We invited great speakers. Coin will be there. And it just blows all our money away to do any other screenings. But we thought it would be better to have a great impact with the full show and a full PR statement at that hospital. And also we partner with the patient organization, so we also reach our communities and the doctors at once. It's a large room as well. But is there any chance you can just we can do something with merchandise, like selling posters, or we were thinking maybe to print pillowcases with the title Unrest on it, so people can buy it and take it home, and we can make some money for further screenings.
Oh man, I love the pillowcase idea. That is awesome. Let us get back to you on merchandise. It's a great question.
Yeah.
I don't know the answer to it right now, but Celine, we'll reach out to you personally, but then we'll also post any information we can in the Facebook
Okay.
group.
And Celine,
when
when is your screening?
Sorry, our screening, we are still negotiating the date. Caroline has contacted your organization and is buying the film on behalf of the patient organization she works for. We have a few places in option, so we do not exactly know the date, but it is between 12 and 15 October.
Okay, thank you.
Probably 13th. That's when we book the hospital, but the hospital is stressing a bit and they want to control the press, and we do not agree to press control, of course. Yeah. So I'm also working on a much cooler location, much friendlier location, less activistic. It's an indie theater, but yeah, I'm not sure they're going for it in October, and we really want Coin there, so we can have a debate with the doctors. That would be high impact.
Yeah.
So we will find a place, but
Great. And Celine, I think, we all know you go gangbusters in the Netherlands, and it's awesome. All the things you guys are doing. So we can be in conversation. I think there are several different options in terms of like, if you're looking at, I'm blowing my budget to try to do this, and there's so many things I want to do, like, let's just have a conversation about that. I think, so some of that is Emmy Action is going to be sponsoring some select screenings. So there may be a way that we can help out there. Or if the challenge is looking at, did you want to do multiple screenings and the screening price per screening it isn't feasible for you, then we can just have a conversation with Film Sprout and us about like what could be a multiple screening license kind of deal. So there's several different and creative ways, if none of those things work, also look at creative ways to raise the money to make it happen.
Yeah.
So if we need to have some kind of crazy special, fundraising campaign online to raise the money to do it, we can figure out how to do that and support that. So it may be just a combination of things. The issue is like every situation is different, and every different group, some groups have the ability to pay, and some groups may have the ability to pay for one thing, and others might be able to go really large, and so we just need to have a discussion about that.
Yeah, is it? I was thinking we have made during the last awareness campaigns, we have made some friends with commercial organizations. Would it be possible after the community screenings to invite them to buy the film and just give them the opportunity? Because for them, 250 is nothing. They so, I mean, it would be interesting to sell it to one of the event organizations that was interested, because they have so many contacts as well. But is it possible to? But it would have to happen after the smaller patient organization screenings, because otherwise they'll just commercialize everything. But I don't know what deal to offer or how to invite them to what exactly. So yeah, we have a film, you can buy it.
Yeah, we can definitely talk more about that, and some folks may that's probably better to talk about offline, because there might be some brainstorming to do. But what I would say is, like, yes, definitely. And one of the things that even came up, we had an impact kind of brainstorming meeting in Australia, in Melbourne, and one of the things that we're working with a team there that has done a lot of kind of impact campaigns around different social issue documentaries, and they've done a lot with getting their films into corporate spaces, and it's actually a really great way to reach people, because they often they have space, and they have people, and it's trivial to kind of make this opportunity available. And at the same time, there are a lot of issues around kind of family leave and caretaking, and also a lot of corporations have diversity programs. So I think it's just a good way, because in some ways that's what we want. We want people who may enjoy the film but have no connection to it whatsoever to also be able to see it, and to kind of get into these spaces where and in some ways to mainstream the disease in every space possible. So I think that's a great idea, and we already have some, although these are more kind of in the biomedical field, we have some kind of companies in Silicon Valley doing kind of private internal corporate screenings as well. So we highly encourage that.
Yeah. Okay, because if they can make money on it for themselves a bit and for you as well, then you can keep rolling with the community, and then we can get also in smaller places or Belgium where it's much harder to get something organized. We could just spread it a bit. It's just maybe we should set up a team for that. I mean, it's really difficult to finance. That's a thing. Yeah, and also if we have more organization, then we could apply for budget in the Netherlands quite easily. But I would have to have like partnership contracts with them, and I don't know. We should also talk about that.
Sounds good, Celine. So Jen, do we want to take any more questions, or do we need to wrap now? What?
I think it's good to wrap. I guess if anyone's on a phone and they had a burning question, we're really sorry, but maybe then Ben, are folks muted?
I can unmute the phones right now, and
No, let's
so
just
if anybody,
unmute all and take like one. If anyone has a really burning question, I would ask it. Otherwise, we can definitely continue the conversation in the Facebook group and then also on our call August 19th.
sounds good. So I'm going to unmute everybody now. Go ahead if you have a question that you really want to get in before the end of the call. All right. Well, it sounds like
amazing.
Sounds like we're good. All right.
Ben,
Thank you
I
all
just want
for
to
joining.
introduce. I just want to introduce
Adrian.
everybody to the latest member of the Emmy Action community.
Yay!
Say hi, Luke. He's here to support and serve in any way he can. Say hi, Luke.
Amazing.
Say hi, sweetie. Okay. Okay.
We're so
Hi,
happy
everybody.
for you, Adrian.
Welcome.
Bye.
Congratulations.
Thanks so much, everyone, for joining today. We're here for any further questions. And like Laurie said, there'll be another call on
August 19th.
August 19th at 11 a.m. Pacific Standard Time.
So same time as this call.
Same time as this call.
Thank you, everybody.
Thank you. Bye, everyone.
Bye. Thank you.
Thanks, everyone. And so just a reminder, I'm going to be sending out that survey link. So if you're interested in doing a free Emmy Action sponsored screening of Unrest, complete that survey and we can be in touch and talk. Thanks, everyone.
Thanks.
Thank you. Bye.
Thank you.
Thank you. Bye.
Bye.